Welcome everyone, and thank you for joining us today for Osteoporosis Canada's webinar in partnership with the Niagara North Family Health Team. Our topic today is reduce your risk of osteoporosis and improve your bone health. My name is Cathy Pearcy, and I'm the Education Community Coordinator for Ontario, and I will be your moderator today. With November being Osteoporosis Awareness Month, it is a great time to bring attention and explore some of the things that we can do to improve and maintain our bone health. Today, we are going to hear how we can reduce our risk of osteoporosis and how we can improve our bone health in three main areas: with food choices, with fitness and exercise, and at the pharmacy. Before we begin, please note, you can enter your questions into the question box to the right of your screen, or if you are watching this on an iPhone, there may be a question icon at the bottom of your screen. We will answer as many questions as possible during our Q&A session at the end of the webinar within the time available. Please keep your questions relevant to the topics discussed, and remember, we cannot provide medical advice to specific individual questions. So this afternoon's lineup, I would like to welcome Lisa Campbell, and then doing a welcome, and then we will be into our presentation about what is osteoporosis, and then looking at ways to reduce, again, as I mentioned, through food choices, fitness, exercise, and we will have a questions panel at the end. So I would like to introduce, first of all, Lisa Campbell. For the past 15 years, Lisa has worked with the Ontario Osteoporosis Strategy. In Lisa's role as a regional integration lead for Halton, Hamilton, and Niagara, she oversees the fracture screening and prevention program, as well as works with family health teams like our partner today, the Niagara North Family Health Team. Welcome, Lisa.
Thank you very much, Cathy. So can you hear me?
Yes, we can.
Okay, great. So we'll just roll right in then to the next slide. As Cathy said, I have been coming up in January. It'll be 15 years that I've been working here. But the Ontario Osteoporosis Strategy was actually funded in 2005. Now, I don't know, Cathy, the cameras are kind of blocking my slide a little bit, but I should be okay. So the goal of the strategy, we're working to reduce morbidity, mortality, and the cost of osteoporosis or osteoporotic fractures using a patient-centered, multidisciplinary approach. We're integrated across the healthcare sectors. We have three priorities with the strategy. Number one is fracture prevention, of course. Number two is health professional education and outreach. And patient education and self-management, much like what we're doing here today, which is excellent. Next slide. The key stakeholders within the Ontario Osteoporosis Strategy, of course, this is not something that can, be done by us alone. So our partners are the Women's College Hospital, Unity Health in Toronto, McMaster University, the Ontario College of Family Physicians, and we represent the vision and coordinated work of all the stakeholders. Fracture prevention for people who are at risk of hip and other osteoporotic fractures really is the priority of the Ontario Osteoporosis Strategy. Next slide. So our core, I'm going to just briefly tell you what our core strategic priorities are. And we'll just move right into the next slide, Cathy. Fracture prevention. First, the primary care initiative. This really supports implementation of primary care pathways for people with or at risk of osteoporosis and osteoporotic fractures. We provide tools, information, and collaboration and in working toward this goal. So primary care being family health teams, community health centers, any other organizations that have primary health or primary care and healthcare practitioners. So we provide the tools and information that these centers need in order to provide you, the patient, the best care that you can receive. Next slide. I see a note there saying that my sound is going up and down. So that could be because I'm using my laptop. I don't know if that's gonna, I didn't notice that happening with Cathy, but I'll just carry on. I only have a couple more slides. So our fracture screening and prevention program, currently we have 28 fracture prevention coordinators who are trained and deployed across the high, medium volume fracture clinics throughout Ontario. And we have screened over 85,000 patients who have fragility fractures, educated and referred these patients on for diagnosis and treatment. Our fracture screening and prevention program has been operational within the Niagara Health System. Today, currently, we're at the St. Catharines site. We've been there since 2006, and our fracture prevention coordinator is Lisa Marie Harney. She's an RPN. She's on the call today. Lisa Marie herself screens over 500 patients a year from that one site. And she has screened the highest number of patients across the province for several years. So there is, it's a very high need within the Niagara region. So we're happy to have Lisa Marie. Thanks. Next slide. We want to improve fracture risk assessment and identifications of these at-risk patients. We want to improve the quality of support provided to these patients in the fracture clinic setting, ensure the appropriate use of diagnostic and assessment tools, including bone mineral density testing, to support the fracture risk assessment and the osteoporosis diagnosis. We want to promote integration of post-fracture care, rehabilitation, and osteoporosis management with fracture patients in acute care settings, facilitate access to specialist support locally through telemedicine to ensure appropriate assessment and care for patients. We typically, with respect to specialists, we refer to Dr. Shake in the Niagara region. Next slide. So patient education and self-management, which is very much like what we're doing here today. We want to provide access to self-management tools and other resources for at-risk patients. And I know the Niagara on the Lake Family Health Team has a really good education program for their patients. We've provided material for a number of years for the nurse that works in that clinic. We want to improve patients and family and informal care providers and to understand their fracture risk and what they can do to reduce their risk of fracturing. And improvements to existing resources and online tools, and introduce self-management principles in existing educational resources for patients. It's important that patients are given the tools to carry on with their day-to-day activities. I mean, you only spend so much time and quite minimal time with your healthcare provider. So we want to make sure that you have the tools to look after yourself when you're at home and on your own. All right, next slide. So as Cathy said, my name is Lisa Campbell. I am the Regional Integration Lead for the Niagara area, and my contact information is there. So if anybody has questions, you can certainly connect after the presentation, and Cathy can provide more information if need be. And next slide. I don't think I have a next slide.
All right.
Thank you very much, and enjoy the rest of your webinar.
Wonderful. Thank you so much, Lisa, for joining us and explaining to us what the strategy does. And you play such an important role in the Niagara region. And Lisa Marie is a busy lady at the clinic.
She sure is. Thanks very much.
All right. So I'd like to introduce the next 4 speakers, and then we'll get into the meat of the presentation today on reducing your risk. So our first speaker will be Dr. Klentrou, and she is an internationally recognized exercise and sports physiologist. Her research program uses applied and basic science approaches to study human performance and the implications of sport training, primarily in youth and children. In the last 5 years, she has focused on how sexual maturation inflammation, adiposity, exercise, and nutrition affect musculoskeletal growth and development. In particular, this research is trying to identify the cellular mechanisms that explain how exercise training and dietary choices during childhood and adolescence affects skeletal development and lifelong bone health. Melissa Dunlop is joining us, and she's a registered dietitian with the Niagara North Family Health Team. Melissa completed her degree in applied human nutrition at the University of Guelph and went on to complete a dietetic internship at Mount Sinai in Toronto. Melissa is a member of the College of Dietitians of Ontario and a member of the Primary Care Dietitians Association. Melissa enjoys sharing her passion for the role nutrition plays in prevention and treatment of many health concerns. Also joining us today is Dr. Gammage, and her research investigates body image and physical activity across diverse populations. Using both qualitative and quantitative approaches, she and her students try to understand factors that can improve positive body image and reduce negative body image. They also look at both physiological and psychological measures of body image. She is also interested in research looking at exercise environment and how it can be structured to promote adherence and positive psychological outcomes. And last but not least, Martina will be joining us. Martina graduated from the University of Waterloo School of Pharmacy in 2016. She has experience in working in a variety of healthcare settings, and currently she practices as a registered pharmacist in the Niagara region. In her role with the Niagara North Family Health Team, she has the opportunity to spend extended one-on-one time with patients, which presents a wonderful opportunity to discuss individual healthcare goals and clinical outcomes. Martina has an interest in public health and disease prevention, and she also enjoys her role as an accessible information resource in the community pharmacy setting. So let's get started. Nota?
Thank you, Cathy. And hello, everybody. So let's talk about bones in general, and then we move on to specifics with the other speakers. So next slide, please. So bone is a very unique tissue because it is made of both organic material, which is proteins, but also inorganic material, which is mainly calcium, but also phosphorus. And that is what hardens actually the bone. And there are two types of bone: the dense cortical bone, which we found on the outer layer of the bones, and mostly on the diaphysis, which is the middle shaft of the long bones. And that's what makes our bones very strong. But we also have trabecular bone that looks like a sponge. And if you see on the left in the picture, that makes up most of the inner part of the bone and the epiphysis of the long bones, which is the edge of the long bones. Next slide. And the bones are important because they provide support. They help us move. They also provide the cavities or the structures that protect the internal organs. And they also provide a storehouse for vital minerals. That's where we store our minerals. And obviously, mostly we store calcium. Next slide. Bone is unique, as I said, from the point of view that is in a dynamic condition. It undergoes growth and then modeling, which is growth, but mostly in width, while growth in length, we call it growth. And then it remodels throughout our lives. That remodeling actually is made mostly in the trabecular bone. So trabecular bone is more metabolically active than cortical bone. So in the next slide, actually is a representation of how this remodeling process that happens continuously throughout our lives happens. So we have these cells called osteoclasts, and these are the bone resorption cells. What they do is they open cavities, small cavities on the surface of the bone. And then cells called osteoblasts, which are the bone formation cells, they refill these cavities with collagen, and that's where the inorganic material will stick, and it will repair and form new bone, as you see on the third picture. During youth, obviously, bone formation exceeds bone resorption, and that's why we have the growth process going on. So we even gain height because the bones grow in length and width, which is more mass. But during adulthood, we see a balance between bone formation and bone resorption. So these two processes must match. How much bone is removed from the osteoclast, it has to be formed by the action of osteoblasts. So that's throughout adulthood. But in old age, for many reasons that happen with aging, unfortunately, formation cannot no longer catch up with resorption. So it's less than what resorption actually does. And that's how we lose bone. Next slide. So in the mid 30s, we start losing about 1% every year of our bones. But as we age and at menopause, this percentage for women actually increases to 2 to 3%. And how much we will lose, it depends of how much we put in the bank in the way. And the bank is called peak bone mass. So during youth, if we actually accumulate by doing the correct activities, more bone, then we start losing at a slower rate, and we do not reach this increased risk area you see in orange there until later in life. So it's very important to make sure that we peak our bone mass when it's time to do so, which is mainly during adolescence. That bone loss also exists in men, although yes, menopause is one of the biggest issues in bone loss. That doesn't mean that men do not lose bone. They actually do, but at a slower rate and after the age of 65. And it can reach that increased risk area in orange there, which basically is the point where fractures start happening in some of the areas of the skeleton. Next slide. So if enough bone is lost, the bone presents like you see on your right, where there is a lot of porosis, there are lots of spaces, it's not as dense. And that's trabecular bone because unfortunately, because it is metabolically more active, that's where we also see more loss of bone. So bones become thin and porous and decrease their strength, obviously, because they lose the integrity, and that leads to increased risk of fracture. Next bone, and next slide. So 1 in 3 women and 1 in 5 men actually have an increased risk have osteoporosis, and if they have osteoporosis, they are at risk for fragility fractures. And these fragility fractures, actually, people do not know, but they are more common than any other condition, including cardiovascular. And in men in particular, it's very dangerous because it is underdiagnosed and underreported. And unfortunately, men are at risk of more complications from hip fractures. And that's exactly because it is not diagnosed early enough and intervened. Next slide. And the common fracture sites are the ones, the 4 that are depicted on the picture on your left. These fractures account for 80% of all fractures after the age of 50 years. And because bone loss doesn't really hurt, it's like a silent disease until a fracture happens, it is very important to monitor and diagnose. Next slide. And the most common fractures, actually, it occurs in the wrist, and that's exactly because in many cases bone loss is underdiagnosed, and it can happen with normal daily activities and not from trauma, not from an accident or of high impact. It's just a fracture that occurs with slight impact or slight fall and normal daily activities, and they're the most serious sign of osteoporosis. And the only way to be able to diagnose that is to have a bone density and bone mineral density or a fracture risk assessment. So people over the age of 50 need to actually be aware of that and try to even self-diagnose, and we can do that, next slide, with a couple of indications. So loss of height is actually a common sign of osteoporosis. If you can see that you lose height at a higher rate after 50, which could be 2 centimeters per year, or 6 centimeters overall since childhood, then that's a sign of osteoporosis. And diagnostic measurements like bone mineral density is then recommended. Next slide. Hip fractures is another serious consequence of osteoporosis, and 40% of people who fracture a hip had prior fracture that they didn't to take as serious. And unfortunately, many times these small fractures, especially wrist fractures, are not taken seriously, but they are, because they are the signs of osteoporosis. A hip fracture, it's actually very dangerous because it could have a lot of subsequent complications from it, and even lead to death in older ages. So it's important to be able to diagnose, self-diagnose, self-assess even prior to reach that stage. Next fracture, please. And then there is prevention, and that's very, very important in osteoporosis, because prevention, as I said, it can start at a very young age, childhood and adolescence, when we actually build bones and we make sure that we peak our bone mass. We reach this peak bone mass early in life, because when we are young, we can actually do so. We can intervene and really strengthen our bones considerably, because the environment, the biochemical environment of our body it's the right one. But we should also keep maintaining some of the activities that can prevent osteoporosis later in life. And we need to remember that bones respond to stress. So as much stress as we put on our bones will properly respond, and more bone will be formed because of that. So if we don't put enough stress in our bone, the opposite happens. We lose density of the bone, and that is serious. It's like a thermostat. More you put, you stress the bones, more new bone is made. And classic examples of how that works is actually the loss of bone through prolonged bed rest, because we don't really put a lot of stress on our bones when we are laying down, because there is no gravitational forces that put a lot of stress on the bones. Astronauts also present with low bone mineral density because of the absence of gravity while in space. So this is good examples of how we lose bone if we don't stress it. Next slide, please. So it's important to use what we have in our disposal, which is physical activity and exercise, to actually both prevent osteoporosis by increasing bone acquisition during young ages, but we also prevent bone loss in older ages through the same strategies, and that's a good management of osteoporosis. I don't think I have another slide after that, because that very nicely leads to the next few presentations of what are the best strategies to actually maintain our bone integrity. Thank you very much.
Hello and welcome to my kitchen. There is lots we can do to support our bone health through our diets. Because we're focusing on prevention today, I have to mention children's bone health. Children are making deposits into their bones and reach peak bone mass in their late teens, early 20s. Some of the best ways to support healthy diets for our children and grandchildren are getting them in the kitchen and involved in cooking, as well as being great role models ourselves. As we age, the focus becomes on keeping bone mass versus making deposits. Because our bones are living tissues and are constantly repairing themselves, they need materials or good nutrition to make those repairs. As we age, it becomes harder to make repairs. However, the more of the right materials available, the better off we will be. Like other areas of our health, it is our entire diet that counts, and what we eat on a regular basis makes the difference. Eating a diet rich in fruits and vegetables is important. Vegetables and fruit are recommended to make up half of our plates. Protein is needed as we age to maintain muscle mass and for bone health. The trick is just getting the right amount of protein. Aim for a serving of protein at each meal. Although we find some protein in many foods, the majority comes from animal proteins, such as poultry, fish, seafood, meats, eggs, dairy products, and plant-based sources, such as soy, beans, lentils, nuts, and seeds. Plant-based proteins are encouraged, but you often need to eat more volume to get the same amount of protein, which can be a challenge for smaller appetites. We hear a lot about calcium when it comes to our bones, and that is because it's a mineral that helps to build and maintain bone. Our body needs calcium for many functions, so if we don't get enough calcium from our diet, calcium will be released from our bones. Milk and milk products have the most calcium per serving. Other foods contain calcium as well, but in lesser amounts. To demonstrate that, I have some servings here. I have 1 cup of regular cow's milk, 1 cup of soy milk, and 3/4 cup of plain yogurt, all of which have about 300 milligrams of calcium. I also have a 3-centimeter cube of cheese, which is around 245 milligrams of calcium. I have 3 ounces of tofu, which equals 130 milligrams. I have 3/4 cup of navy beans, which is equal to 95 milligrams, a 1/4 cup of almonds, which is 93, and a 1/2 cup of broccoli, which is equal to 33 milligrams of calcium. But how much calcium do you need? Adults aged 19 to 50 require 1,000 milligrams per day. Those over 50 require 1,200 milligrams daily. So if you're over 50, if you get 3 servings of milk or milk products daily, you get 900 milligrams of calcium. All the other foods in your diet usually add up to 300 milligrams, giving you that 1,200 milligrams required. Let's go through what a day of bone healthy eating might look like. I like to start my day with having a coffee, but why not make that coffee into a latte using regular milk or milk alternative? When using milk alternatives, make sure that you check that they're fortified by looking on the label. Not all are fortified the same. Also, keep in mind that the calcium is added to these products, and therefore we may not absorb as much calcium as we would from regular milk. For example, 75% of the calcium from soy milk beverage is absorbed. I also look for the sugars and try to choose one with less sugar. Milk alternatives also generally do not have as much protein as regular milk, so you may have to make up for that somewhere else in your diet. When you're going to use your milk alternative, make sure you shake it really well before you pour it. This will make sure that the calcium is dispersed evenly throughout the product. If you're lactose intolerant, that means that you have trouble digesting the natural sugar found in milk. Luckily, there's lots of lactose-free products now available. You can find more information about calcium on Osteoporosis Canada website. They also have a handy calcium calculator you can use to see how much calcium you are getting throughout your day. It is best to meet our calcium requirements through food rather than taking supplements. It's also best to spread our calcium intake throughout the day. Getting back to that latte, what about caffeine's impact on bone health? Well, large amounts can impact our bone health negatively, therefore moderation is likely best. I made some oatmeal for breakfast. When making your oatmeal, you can use milk or milk alternative instead of water to add more calcium. I've added some chopped prunes for sweetness and some almonds, which are a source of calcium and protein. Often we don't get enough protein at breakfast, and protein spread throughout the day can help slow muscle loss as we age. I've also paired that with an orange, which provides 50 milligrams of calcium and some vitamin C. For lunch, I've made a kale and cheddar frittata. Leafy greens contain a powerhouse of nutrients for bone health: calcium, vitamin K, potassium, vitamin C, just to name a few. I used kale instead of spinach because the calcium in spinach is not well absorbed, because spinach contains something called oxalates, which bind calcium. Frittata is made with eggs. Egg yolks are a source of vitamin D. Vitamin D helps your body use and absorb calcium. Most vitamin D comes from the sun. Therefore, in Canada, we need to supplement. My colleague Martina will talk more about that later. Eggs also contain vitamin K2, which is needed for bone mineralization. Pair the frittata with a glass of milk, and you've got a lovely lunch. For a vegan lunch option, I've made some kale and white kidney bean soup. White kidney beans contain protein, potassium, calcium, magnesium, and B vitamins. I use canned and I rinse them well. Navy beans, pinto beans, and chickpeas are also all good sources of calcium that you could interchange in this soup. When making the soup, I often use a store-bought broth for convenience. I look for a lower sodium option. Diets high in processed foods and canned foods contain excess salt, which can cause calcium to be lost in our urine. You can pair that with a glass of soy milk, and again, there's lunch. If it's mid-afternoon and you're feeling a little hungry, how about an apple with some almond butter? And then for supper, I've made some salmon patties. When you're using canned salmon, don't get rid of the bones, crush the bones and use them in your recipe because it makes it a really good source of calcium. Canned salmon is also a good food source of vitamin D. I paired the salmon patties with some bok choy, which is also a good source of calcium. What about that glass of red wine with supper? Again, moderation is key. Too much alcohol can increase bone loss. And I haven't forgotten about dessert. Here I've just made some plain yogurt with some berries. I usually choose plain yogurt. When you go to the grocery store, there's so many to choose from. I tend to just stick with the plain yogurt, and I sweeten myself with some honey, maple syrup, or even some frozen berries. There's lots of lactose-free options available as far as yogurt goes. I hope you've learned about a healthy diet to support bone health. Now it's time to learn about the role exercise plays. I will turn it over now to Kimberley. Thanks for listening.
All right, thank you very much. And I just want to make sure you can hear me? Okay, perfect. So I'm going to talk about the role of exercise for preventing osteoporosis. And my interest in this comes a lot. I am the director of the Senior Fit Exercise Program at the Brock Niagara Center for Health and Wellbeing. So we have members 55 years of age and older. So we obviously have a lot of members who are either still trying to prevent osteoporosis or who have been diagnosed with osteoporosis. So it's a really important point for us to, it's a really important condition for us to be aware of when we're working with a lot of our members. Next slide, please. So as Dr. Klentrou talked on earlier in her talk, we want to exercise for lots of reasons. If we're focusing on bone health, during child and adolescence, we're really looking at exercise as a way to build that peak bone mass and strengthen our muscles. And then as we move into adulthood and older adulthood, exercise is really most important to reduce bone loss, to maintain muscle strength, and to reduce our fall risk. And I will also say that I think exercise is fun, and that's probably the primary reason that I would encourage everybody to be active. Next slide, please. So I'm going to talk about 4 different kinds of exercise, and then I'm going to sneak one more kind in as well. I'm going to talk about weight-bearing, aerobic activity, and impact activity. I'm going to talk about muscle strengthening and resistance exercises. I'm going to take a quick look at balance activities, and then we'll also look at posture activities. Next slide, please. So aerobic activity or aerobic exercise is any activity that gets our heart rate up. It makes us sweat a little bit. And there's lots of different activities out there that we can choose from. If we're looking at prevention of osteoporosis, ideally what we want to choose are weight-bearing activities. And these are just activities where the bones and muscles in our body have to support our body weight as we work against gravity. So anything, any type of activity like walking, whether it's outside or whether the weather turns colder and we're inside walking on a treadmill, jumping rope, hiking outside, running up and down stairs, using an elliptical trainer, all of these are examples of weight-bearing activities. Activities like cycling and swimming are great aerobic activities. They're excellent for your heart. They have lots of benefits, but in terms of bone health, they're not as good as some of these other weight-bearing activities. The other thing we want to do where possible, and if it's safe for us, is to choose high or low impact activities. High impact activities are those where both feet are off the ground at the same time. So our jump rope example there. And low impact activities are activities where one foot is off the ground at a time. So walking, running, anything like that. And these types, this impact loads the bones, it stresses the bones a little bit more. And so there's additional benefits in terms of our bone health. Next slide, please. So in terms of aerobic activity, what else do you need to know? Our Canadian physical activity guidelines recommend 150 minutes of aerobic activity accumulated over the course of the week in bouts of at least 10 minutes. So that means you could do 10 minutes of walking before breakfast in the morning, 10 minutes at lunch, and 10 minutes after dinner, 5 days of the week, and you've accumulated your 150 minutes. Or you could do 60 minutes of exercise on 2 days per week and 30 minutes of exercise on another day of the week, all in a row, and still get your 150 minutes. And I'm also going to add that if you can get more than 150 minutes, that's even better. The intensity we want to be working at is moderate to vigorous. So how do we know what is moderate vigorous exercise if we don't have a Fitbit or some other type of device? Well, moderate to vigorous intensity exercise is going to warm up our body so that we're going to start to sweat. We're going to feel our heart beating faster. We're going to be breathing deeper and faster in order to get enough oxygen in to supply all our muscles with that oxygen we need. And we should be able to talk a little bit, but we shouldn't be able to sing. If we can sing a song or we can recite a Shakespearean soliloquy, then we need to just take that intensity up a little bit. On the right side of the slide there, I have a scale that is rating of perceived exertion. And this is, we use this scale to answer the question, how hard do you feel you're working right now? And ideally moderate to vigorous, the answer to that question is I'm somewhere between a 3 and an 8 out of 10. And if you can say that honestly while you're exercising, you're right in that moderate to vigorous intensity zone, and you should just keep going. Next slide, please. So the second type of exercise that I want to talk about is muscle strengthening and resistance exercise, and this is extremely important for bone health. This type of exercise just moves your body or moves some sort of internal object against gravity. So we most often think of weight training, whether it's machines, whether it's dumbbells. I have a picture of a woman using a kettlebell. It could be your body weight, like the picture of the push-up in the middle. Or we could use other things like resistance tubing, TheraBands, like we have in the picture on the right-hand side. And these three exercises I have pictured here, a squat, a push-up, and a row, are all excellent exercises that will strengthen key parts of the body. So we get the lower body in that squat, we get the upper body, wrists, shoulders, chest, back with our push-up, and we get the upper back, which is really important, particularly for posture, with that row on the right-hand side. Next slide, please. So what else do you need to know about muscle strengthening exercises? Ideally, we do these exercises 2 to 3 days per week, but not on consecutive days. In a perfect world, we will leave a day in between each of our muscle training sessions. We want to target all the major muscle groups of the body, so our upper back, arms, shoulders, and chest, and then with our legs, the upper legs, so quadriceps, hamstrings, inner and outer thigh, and then the lower legs are calves. And we also want to make sure that we target the core, and I'm going to address that a little more specifically on the next slide because it's so important. In terms of how much, you want to do at least one set of 10 to 12 repetitions. So each time you do the exercise one single time, that's a repetition, and we want to try and do that about 10 to 12 times. You know you're working hard enough when the last repetition or two that you do feels hard. You feel like, I can't do anymore. This is really challenging. When it starts to get easy, and as you start to do this more and more, those last repetitions will get easier. You can make it more challenging again by either adding a little more weight, by adding a couple of additional repetitions, so maybe going from 12 repetitions to 15, or we could add an additional set. So we do our 10 to 12 repetitions, we take a little break, and then we do 10 to 12 repetitions again. Next slide, please. I said I wanted to address core training in particular because core training is extremely important. Our core really goes from our shoulder girdle to our pelvis and everything in between in the front and back. So it includes our abs, our obliques, our low back. And a strong core is important for lots of reasons. All our movement originates from the core. So if we want to move effectively, we need to have a nice strong core. It's extremely important for good posture that we'll talk about next. And it's really important for balance as well. So strengthening through the core is key. I've got some key exercises here that are excellent core strengthening exercises, and they work that entire core region. Along the top, I have a picture of the plank, either from our toes or from our knees. And then the third picture there is a side plank. At the very bottom of the screen, I have an exercise called the bird dog, or if you've been to yoga before, spinal balance. And then on the right-hand side, I have an exercise called the bridge, which tends to focus a little bit more on the back side of the body. All of these are excellent, safe core exercises, and you'll notice that there's not a crunch in the bunch of them, which is ideal, I think, whether you have osteoporosis or not. Next slide, please. In terms of core training, at least 2 to 3 days per week of core exercises. And the key here is making sure that your core is engaged the entire time. And the cue that I like to give is saying, think about pulling your belly button gently in towards the spine and up. And we can do that not just while we're doing core exercises, but pretty much throughout our entire day. And the key message that I want to say is you never have to do another crunch again to get a strong core. Next slide, please. Balance training is also really important for the prevention of falls. And there's lots of different activities that people can do. Along the left-hand side of the screen and then the top row of pictures, I have people that are doing balance-specific activities that challenge different systems of the body to help you maintain balance, to improve our overall sense of balance. Or we can engage in activities where balance is an important part of it, like yoga or Tai Chi, as I've shown in the pictures at the bottom of the screen. These activities naturally challenge our balance and have been associated with improvements in balance. Next slide, please. Balance training is something that should be done daily for about 15 to 20 minutes per day if possible. Safety is critical, so always making sure that if you're doing balance activities like standing on one foot, for example, that you're near a stable chair or a table or a wall or a counter, something where if you start to lose your balance, you can hold on to avoid falls. You want to progress gradually. So we talk about, for example, maybe starting on 2 feet, standing hip width apart, then maybe moving to your feet together, then maybe moving to 1 foot. Being able to do activities with your eyes open and then potentially progressing to having your eyes closed as ways to gradually increase the challenge of these balance exercises. One thing I do want to say that I often run across when we're working with some of our seniors is that every day is different. What you can do one day may be very different than what you can do on the next day. Things like how much sleep you got, medications, what you've eaten, how much exercise you've done, how tired you are, all of those can impact your balance. So as you're challenging yourself, making sure you're challenging yourself on how you're feeling that day is particularly important. And my best tip, keep your core engaged and focus on a single point in front of you to help you with your balance. Next slide, please. Posture exercises are always really important. And I always feel silly saying posture exercises because it sounds like something that we should just be doing while we're doing our other exercises. And it's actually something we should be thinking about all the time. I got this actually from the Osteoporosis website, talking about what proper posture looks like, both seated and standing. So when we're standing, our feet are hip width apart and our weight is equally distributed. If you take a moment during the day to notice how you're standing, we'll notice a lot of us kind of shift our weight onto one side, and we want to try and avoid that and make sure weight is equal in our right and left feet. Our abdominals are engaged, so that belly button to spine, and our tailbone just tilted down slightly. We want to keep that natural curve that is in our spine. I always think about lengthening spine. So I'll say, imagine someone's tied a string to your head and they're pulling up on that string. And if I could see everybody now, as soon as I say that, I usually see an audience all sit about 2 inches taller than they were before. Shoulder blades down and back and relaxed, so your collarbones are wide. I always say, imagine you're wearing a pair of jeans with a pocket, and you want to think about putting your shoulder blades into the back pocket. As soon as we do that, we'll feel much wider. We have a nice proud chest, and we want to keep that the entire time. Our chin is tucked in, so we don't want our chin sticking out. And when we do that and look straight ahead, we'll see, as we see in the picture here, we have a nice straight line that goes from our earlobe to our shoulder, right down through our hip and down to our ankle. And that's how we know we're in proper alignment. When we're seated, it's almost all of the same cues. We want our knees, hips, and ankles at about 90 degrees so our feet can sit flat on the floor. Abs still engaged, tailbone still tucked down, shoulder blades still down and relaxed, and our chin tucked. And we can draw that straight line from our earlobe through our shoulder and right down through our hip. Next slide, please. So some simple posture exercises that we can do to practice and make good posture a habit. Chin tucks, where we take our chin from that good posture position, take it back. My mom would be appalled because it's really trying to make us look like we have a double chin here, and then coming back. Neck rotations, where we can just turn from side to side, just within a natural range of motion. A head turn, where we can drop one ear to the same shoulder. Shoulder rotations, particularly backwards. And I like to think about really putting those shoulder blades in the back pockets when I do this. Chest openers, where we take our arms behind our back. I always say, try and think about touching your elbows behind your back. This is really important for posture because in our society, we tend to do everything in front of our body. We read, we're on phones, we're on computers, we're driving, and we're arched forward. And the muscles in the front of our body become very short and very tight, and that contributes to poor posture. So we want to stretch them, we want to open them, and counteract that position that we're all the time. And the last posture exercise that's great is wall angels. I have a picture here. We stand up against a wall to make sure we maintain that good posture. And then we can just slide the arms up and down, keeping those shoulder blades, keeping the back of the head in contact with the wall. And all of those are great and simple exercises that we can do to help work on our posture. But the best thing we can do is being aware of our posture all of the time. Next slide, please. So we should be doing these posture exercises daily, 5 to 10 minutes a day. But as I said, don't think of good posture as something we only are concerned about with exercise. We think about it at all times, standing, seated, in any activity we're doing. Next slide, please. I do want to put a plug in for flexibility exercise for stretching, because although they're not necessarily as important for bone health, it's important for mobility, posture, and our ability to do activities of daily living. We can do it daily, particularly we should do it after any aerobic or resistance activity. And really we're going to stretch the same muscles that we worked in resistance training: chest and back, arm and shoulders, and the entire lower body. We want to move to the point of gentle tension in any stretch, never pain, and we want to hold it for 20 to 30 seconds. And that will seem like forever. You'll think that must have been 20 seconds, and you'll look at your watch and it will have been 6 seconds. And I really urge you to hold it a little bit longer. It's a nice time to relax and breathe and kind of gather your thoughts. Next slide, please. Warm up and cool down, extremely important, particularly before our aerobic and strength training activities. These warm-ups will gradually increase our heart rate and body temperature and our breathing rate and prepare our joints for movements. The cool down just does the opposite. In the warm-up, we want about 10 minutes or so, starting with smaller movements and letting those movements slowly getting bigger. With that cool down, we can bring that heart rate down a little bit and then finish up with some static stretches. So it's a great way to get those flexibility exercises into our regular exercise program. Next slide, please. If you have osteoporosis, the general guidelines are the same. If you are new to exercise, particularly, I'd really recommend talking to a physiotherapist or a kinesiologist before you get started. They can give you some good advice and really tailor an exercise program to you. You want to avoid high impact activities and any activities where you're bending forward at the spine, like crunches, but none of us need to do crunches anyway. And we want to avoid any activities that have rapid, repetitive, or extreme twisting of the spine, especially while we're bending forward. And we don't want to lift very, very heavy weights. And there's no need to lift very, very heavy weights to get these benefits on our bones. Next slide, please. We also want to engage in spine-sparing strategies at all times. And the principle here is just modifying any activity or exercise we're doing. If it is extremely fast, if it's very repetitive, we're doing a motion over and over again. If it's heavily weighted, or we're moving to the extreme end range of motion, particularly bending forward in the spine inflection or rotating the spine. Some keys for spine-sparing strategies: keep our knees soft all of the time. A little bend in the knees will help us keep long through the spine. And when we're bending forward, rather than rounding at the spine, we want to keep that nice long spine and hinge forward at the hips. A good tip for that hinge forward: place our fingertips just in that hip crease. And as we hinge forward at the hips, we should feel pressure on the fingertips. Don't stand or sit for too long. Set your alarm and get up and move around every 20 minutes or so. If we're lifting or carrying heavy objects, keep them close to our body and distribute the weight equally across the body. Wear a backpack that sits on the center of our back rather than carrying a big bag on one shoulder, for example. We want to move slowly. If we're turning, move our feet to turn our body rather than twisting, and just be mindful of what we're doing. Next slide, please. And the last thing is plan your exercise and exercise your plan. All the greatest exercises in the world aren't any good if we don't do them. Set yourself 1 to 2 exercise goals. For example, I want to learn to balance on one foot for 30 seconds, hold a plank for 30 seconds, or perform 10 perfect push-ups over the next 6 to 8 weeks. But be realistic with your goals and be flexible. Develop your plan. Decide who, what, when, where, and how long you're going to exercise for, and then write it down. When we write things down, we automatically become more committed. And if you tell somebody else, that gives us an additional sense of accountability. And plan for challenges. Things are going to happen that we can't control, and we want to figure out in advance, how are we going to deal with them? So as the holiday season comes up and we get busy, how are we going to be able to fit exercise into our day? And finally, make it enjoyable. Pick activities that you like, work out with a friend, try a new activity and learn something different, or add music to your workouts, and that will all make it more fun, and then you're much more likely to stick with it. Next slide, please. I think that's it for me, and I will pass it on to our pharmacist.
Good afternoon, everyone. My name is Martina Schubert, and I am a pharmacist with the Niagara North Family Health Team. I'm visiting one of our local pharmacies, and today I'd like to discuss some recommendations on how to reduce your risk of osteoporosis and improve bone health at the pharmacy. In addition to the important lifestyle changes that have been discussed so far, including being physically active and consuming a well-balanced diet, in some circumstances, medication may be needed in order to help build and strengthen our bones, as well as reduce the chances of breaking a bone.
Calcium and vitamin D are very important nutrients for proper bone health. Calcium is a mineral essential for bone strength. Vitamin D helps to increase the absorption of calcium in the body. Therefore, it also aids in the building of strong, healthy bones. Vitamin D can also improve muscle function and balance, and may lower the risk of falls, which can lead to fractures. Osteoporosis Canada recommends trying to obtain these nutrients from food and drink sources as best as you can. But if this is not possible, it may be appropriate for you to take supplements. It's important to know that extra calcium from foods is not harmful. However, extra calcium from supplements may be. If you are already getting enough calcium in your diet, there is no need to take a supplement.
Oftentimes, selecting a supplement may be a very overwhelming task. Here, I'm standing in a section of a local pharmacy supplement aisle. As you can see, there are many different brands, strengths, and formulations available. It is very important to speak with your healthcare provider prior to taking a calcium supplement, as they can have some side effects. Your pharmacist can assist you in finding a safe product that fulfills your specific needs.
With respect to calcium in particular, Osteoporosis Canada recommends that adults under 50 years of age, including pregnant or breastfeeding women, obtain a total of 1,000 milligrams of calcium daily from diet and supplementation. Those over 50 require 1,200 milligrams of calcium daily. Calcium supplements are commonly available with one of two sources of elemental calcium, typically carbonate or citrate. Calcium carbonate should be taken with or after meals for best absorption. Calcium citrate may be taken without regards to meals. Calcium doses above 500 milligrams are not absorbed as well as smaller doses. Therefore, if it is necessary for you to take greater than 500 milligrams of calcium from a supplement in order to achieve Osteoporosis Canada's recommendations, it may be appropriate for you to split up your supplement dose into 2 or more administration times. For example, it may be suggested that you take a smaller portion of your daily dose in the morning and the remainder in the evening. Some people experience side effects related to calcium supplements. The most common ones are constipation and upset stomach. Some patients find that these symptoms may be reduced by splitting up their calcium into a few smaller doses each day instead of taking one larger dose. Your pharmacist is an excellent resource if you are ever seeking guidance on dosing or side effects to medications. Of note, calcium supplements may interfere with the absorption of certain medications. Your pharmacist is also able to help answer specific questions about drug interactions and can suggest an appropriate regimen for safely spacing out your medications. Vitamin D is often referred to as the sunshine vitamin. It is produced when the sun's rays interact with our skin. In Canada, especially throughout the winter months, many of us do not get as much sun as we need to produce adequate amounts of vitamin D. There are also very few food sources of vitamin D, which makes it challenging to obtain enough vitamin D from diet alone. Therefore, Osteoporosis Canada recommends routine vitamin D supplementation for adults all year round, specifically vitamin D3 or cholecalciferol. Healthy adults between 19 to 50 years of age typically require 400 to 1,000 international units daily. Those over 50, or younger adults at high risk should receive 800 to 2,000 international units daily. If you are taking a multivitamin, it may include some vitamin D3 and calcium. This information may be found on the supplement facts label of the product. If there is not enough of each nutrient to satisfy Osteoporosis Canada's recommendations, please chat with your pharmacist to discuss an individualized plan that is most appropriate for you. Although the focus of today's webinar is to discuss prevention of osteoporosis, I will conclude with a brief overview of some prescription treatment options in case this may be of interest to some listeners. Treatment of osteoporosis focuses on preventing or reducing bone fractures and maintaining or increasing bone density. Every individual is unique. Some people respond better to one drug over another. Some experience side effects that others don't. It is important to speak with your doctor to determine which option is most suitable for you. The following are some of the osteoporosis medications that are available in Canada. Bisphosphonates are one of the main groups of medications that may be used to prevent and treat osteoporosis. These medications slow bone loss and help to repair bone. Bisphosphonates increase bone density and reduce the risk of fractures. The selective estrogen receptor modulators, or SERMs, are in another class of medications. Although these medications are non-hormonal, they act like the hormone estrogen, which helps to build and maintain bone density. They may be used to prevent and treat osteoporosis in women. Denosumab or Prolia is a part of a class of medications called the rank ligand inhibitors. It stops the breakdown of bones, helping to strengthen them, and also reduces the chances of fracture. Prolia is given as an injection every 6 months. Hormone therapy is commonly used to relieve the symptoms of menopause. However, because estrogen plays an important role in maintaining bone, hormone therapy may be considered as an option to treat osteoporosis in women who are also seeking relief of menopausal symptoms. Estrogen replacement may help to preserve bone and manage menopausal symptoms such as hot flashes and night sweats. It increases bone density and prevents certain types of fractures. The parathyroid hormone analogs are also referred to as bone formation agents. Teriparatide is an injection and is the first medication approved by Health Canada in this family of medications. It works by activating the bone-building cells and essentially builds new bone at a faster rate than old bone is broken down. Therefore, it aims to increase bone density and reduce the risk of fractures associated with osteoporosis. Romosozumab, or Evenity, is the newest option that we have available for the treatment of osteoporosis. It has a unique mechanism of action as it works in 2 ways in the body. At the same time, it works to both build new bone and slow bone loss. Evenity increases bone strength and reduces the risk of fractures. This medication is administered as an injection by a trained healthcare professional. If it is suggested that you take a prescription medication for prevention or treatment of osteoporosis, it is still very important that you continue to get enough calcium and vitamin D through diet and supplementation. I briefly mentioned this earlier when discussing calcium supplements in particular, but it is also important to note that some other prescription medications and over-the-counter supplements may interact with certain osteoporosis medications. If you are ever unsure, please chat with your pharmacist prior to initiating any new medications or supplements to ensure that you obtain the best results from your osteoporosis therapy. If you are interested in learning more about options for helping with organizing your medications, your pharmacy may be able to dispense your medications in blister packs, dosettes, or strip packaging?
These compliance aids may be very useful if you are taking a large number of medications or if you find it challenging to remember to take them on a regular basis. Some osteoporosis medications are taken once a week or once a month, and for this reason, they may be difficult to keep track of. Please do not hesitate to speak with your pharmacist about ways in which you can optimize the effectiveness of your medications.
Thank you all very much for listening along. I'm happy to discuss any questions that you may have in our upcoming Q&A session. Take care.
Okay, well, thank you, everyone. I'm going to switch it over to the panel. Let's see if any questions have come in. Okay, so can everyone hear me? And if the panelists could unmute themselves. There's everyone. Hello, everyone. So I'm just looking at some of the questions that have come in. Martina, this one might be for you. Are there any side effects with taking Prolia for long periods of time? I know it may not have been out long enough to know about what the side effects are, but do you know any side effects?
So this can become quite a lengthy answer, so I'll try to keep it brief for today, but I would encourage anybody that is discussing Prolia with their doctor or pharmacist to have an in-depth discussion. But some of the common side effects are pain at various sites in the body, so we always try to encourage patients that are prescribed Prolia to monitor for any new onset pain and to report that as soon as possible. Prolia can also cause irritation, redness, or itchiness on the skin, which is often characterized as eczema. And then it can also increase your risk of certain types of infections. So I'll try to keep that brief for today, but I'm happy to dive a little bit deeper into that if anybody has any particular questions about the types of infections or other types of possible side effects.
Wonderful, thank you.
And Cathy, if I may jump in here.
Yes, please.
While taking Prolia or other similar drugs, someone cannot perform a dentist type of like reconstruction in the tooth and the because it contradicts.
Wonderful, thank you.
Any dentist procedures need to be discussed. If you take Prolia, they need to know.
Right. Now, this might be a question for you then too. How frequently should a healthy senior person have a bone density test?
Once a year.
And with COVID restrictions, are bone density tests still being done?
Well, unfortunately, not across Ontario. I don't think it's the same. It depends on the clinic and the restrictions, the regional restrictions. So not all the regions are in the same restriction, phase. But for the most part, the diagnostic tests should go ahead. Unfortunately, the ones that have been sponsored by the Ontario government until now, like one of them is the breast cancer screening, they stopped sending the reminders and so on. So they're not doing that from what I know. But if your family doctor prescribes any of these diagnostic tests, yes, it can be done. And it can be done very safely. I think the health professionals know how to protect both the patient and themselves.
Right. Kim, I think this one goes your way. Should crunches, forward bends, spinal rotations be avoided by anyone or just those diagnosed with osteoporosis?
So avoided by people with osteoporosis. I actually think if you don't have osteoporosis, those movements are movements we make in everyday life. So there are movements that we should be training. The reason and if you look at most experts in who are recommending for core exercises, we say no crunches, is they tend to put a lot of excess pressure on the spine and don't actually do all that good a job of strengthening through the core. So they strengthen one particular muscle that sits on the outside that gives us our six pack, but they don't provide a lot of they don't target a lot of the other muscles that are really important. So you don't want to avoid those movements because we twist in real life. If you vacuum, if you rake leaves, if you turn and grab something off your counter, we're making those movements in everyday life. And so we want to train all the muscles to be able to make them safely. If you have osteoporosis, that's where the recommendation is to avoid those types of movements.
Wonderful. Actually, another kind of a COVID question. So this individual says, I've been running and walking at least 30 minutes per day. I'm concerned that winter's coming, it will be slippery outside. What do you recommend doing inside the home in the winter to get the impact safely? And this person does not have a treadmill.
So if you have stairs in your house, walking up and down the stairs can actually be a really good option. There's, the good thing about the technology we have in YouTube, when you can find reputable sources, there's actually lots of options to be able to do like a low impact exercise. That's at the center, we offer virtual exercise programming where we offer low and high impact versions of everything and with no equipment. So there are things you can do, marching on the spot, jumping jacks, either high impact or low impact. A lot of the strengthening exercises, so squats and push-ups and things like that, all of those types of exercises, you need very little space for, and you don't actually need any equipment for.
Excellent, thank you. Melissa, there is a question here. For adults over 50, what might be a good breakdown per meal for protein?
That's a great question. Thanks for that question. It's actually a tricky question because the protein requirements, really, there's a lot of controversy right now around protein requirements and how much protein we actually need. I would use my hand as an example of to figure out portion sizes of protein. So usually your palm, if you're having a meat or poultry, a palm of your hand is a serving of protein. Usually about going like this, this would be about a 3/4 cup of beans. And then this little space in here would be about a 1/4 cup of almonds. So that would give you an idea kind of the portion sizes of protein. But usually we aim for, everybody's protein requirement is going to be different. We usually base it on grams per kilogram of body weight. So it is very individualized, but usually we aim for around 20 to 30 grams of protein per meal. But again, I think as research comes out, I think we're gonna see some changes maybe to our RDAs as far as protein goes. So that's a great question. Thank you.
And I think we're a little over, we're running out of time. I have one last question regarding magnesium. If you take magnesium in the evening, will it affect calcium absorption during the day?
So I can answer that question. Calcium and magnesium can interfere with each other for absorption in the body. So we would suggest spacing them out as best as possible. So if this viewer is taking a calcium supplement in the morning and then the magnesium at bedtime, that would be safely spaced out for adequate absorption of both products.
Wonderful. Oh my goodness, there's so many great questions here, but we're running out of time. One last one. Is there such a thing as lactose-free yogurt?
Yes, you can find lactose-free yogurt. For sure in the grocery store. So you'll see it labeled there, it'll say lactose free. There's a couple different brands that carry it.
Okay, wonderful. Wow, I want to thank everyone I'm just going to switch over here. Maybe Matthew, you can change my view here. I would like to thank everyone for joining us today. So much great information shared. I know we've gone over, but there was just so much to talk about. I would like to thank all of our speakers today for sharing such important information on bone health and the importance of keeping our bones healthy. And again, starting at that younger age. I would also like to thank the Niagara North Family Health Team for all of your contributions today. So if you're looking for more information, please visit our website, www.osteoporosis.ca. And lastly, I would like to thank you, our audience, for joining us today. Thank you so much and have a wonderful day.
Thank you, everybody, and goodbye.
Thank you.
Thank you.